I'm Dr. Robert Princenthal. I'm the medical director of RadNet's prostate imaging program and men's health program. And we're excited to encourage men to get screened and take care of themselves just the way that women do with their mammograms. Most men are at risk for prostate cancer, and they frequently don't get screened. But we're here to say that with the PSA blood test, and if it's elevated, to get a prostate MR, we can triage men who would need a biopsy with a higher accuracy. But more importantly, the majority of men don't have anything suspicious, and they can avoid a biopsy safely. And prostate cancer and breast cancer are really two sides of the same coin. 250,000 men and women each year are diagnosed with their diseases, and roughly 30,000 men and women die. Women have been much stronger in advocating for their own health, and instead of having mastectomy as the treatment for breast cancer, now they're pushing for simpler, less involved treatments such as simple lumpectomy and breast conservation. For men with prostate cancer, if there was a little tumor there, the only treatment was to rip the gland out, all or nothing, black or white. And the problem with prostatectomy is it left a lot of men with some side effects, impotence and incontinence, what we call I squared. So a lot of men were more afraid of the treatment than the disease itself. So now, finally, we offer TULSA Pro form of HIFU, high-intensity focused ultrasound. So just the way that women advocated for less aggressive treatments for their breast cancers, why take out the whole prostate if there's a small spot of tumor? So this device is MR-guided in the MR suite under anesthesia, and we used high-intensity focused ultrasound with negative feedback so we can measure precisely the heat map, and we can cook and kill the tissue with precision and spare the nerves and maintain all of the important functions that men enjoy. And we have a great group of urologists who support this, and we work collaboratively with our urology partners. Let's talk about men's health and screening. The advantage of prostate MR is that we're pre-selecting a group of men who may be at increased risk. We recommend that all men from 50 on ask their doctors to get a baseline PSA. The government, in its infinite wisdom, back in 2008 to 2012, thought that the PSA blood test was not useful, and men didn't get the PSA blood test, and as a result, we're finding more men now presenting with late advanced stage disease. We can change that narrative. If you get a PSA blood test, and if it's rising or elevated, ask your doctor to order a prostate MR. Because with prostate MR, we can precisely see the suspicious spots within the gland. And when we do that, we can direct the needle with high precision to make sure that the biopsy is concordant with what the tumor actually is doing. But more importantly, we can encourage men to follow up and not get a biopsy if we don't see anything there. Prostate MR has a 90% negative predictive value. Almost no imaging study has that degree of precision of excluding a significant disease. But more importantly, if we see something suspicious, we find cancer in over 85% of the time. So men need to take a page out of the women's playbook and ask to be proactive and to get screened and not be afraid of the disease. We can help you stay fit, and we can help you live longer and take care of potential problems before they become serious. So RadNet is a pioneer in the artificial intelligence space. Everybody now, the buzzwords are AI this, AI that. What does it really mean? So radiology, we're good, but we're dealing with pixels. We're dealing with computer-generated spots that generate anatomy. And when there is a standard process for evaluating those pixels, the computer can help us identify the abnormalities perhaps better than we can. So we're partnering up with our company Deep Health and Quantib to develop a robust artificial intelligence program to allow us to be more precise with prostate MR and to be more efficient in getting the cases evaluated. So artificial intelligence is at its infancy, but we're excited that the heat maps that it generates allows us to find more cancers and to do it at a faster time and hopefully at a lower cost. So be sure to ask and see if your center is using AI to help the radiologist. We think that men's health is a complete integrative process with diet, with exercise, with taking supplements if you have a low testosterone under a physician's supervision, of a diet and exercise program under supervision, but to also make sure that you stretch, that you maintain being limber, that you are not sedentary. Sitting is a real risk factor for cardiac disease. If you sit too long, your Apple Watch should tell you to stand up and take a walk. We support all of these easy preventative health measures. But what we're really here to talk about is to make sure you check for prostate cancer. We want to make sure that you live a long and happy and healthy life